Genetically, we touched upon this already, methylation. If you genetically don't methylate, you need that methylfolate and that methylated B12 to do a lot of business in your body. You know, we mentioned it before, like the methylfolate is the actual like methyl donor to run the COMT pathway. It also will run a histamine clearance pathway. I tell the students all the time in biochemistry, when you're seeing the ending on a name of something, if it's MT, that's a methyltransferase that needs a methyl donor. So that's going to come from B12 and folate most often. And so if you have that, do not listen to the B12 and folate lab value to determine if you need if you need a B vitamin or not, right? So in fact, methylfolate isn't measured in the body. Unfortunately, we don't really have a test for it. The best way you can understand if you need it is to do a genetic analysis, and then also maybe you could kind of surmise to use the homocysteine, you know, but there's no direct test for methylfolate. So you can really have normal levels of folic acid and even elevated levels of folic acid, but be low in methylfolate. And especially if methylfolate is stabilizing neurotransmitters and cardiovascular inflammation, you're not going to pull somebody off that if it looks elevated in the serum. Okay, so you really want to understand somebody's methylfolate genetics before you go messing with those vitamins.